and because we had come to accept the fact that, well, pain was just like was a completely physical thing, and it was like your heart rate or your blood pressure, that you could just essentially treat it as long as you just gave enough medication, and ignored the fact that there's more to pain than just that there it has these vast dimensions of that are connected to our emotions, to our histories as human beings, to our histories of having lived with trauma.
Hi, friends. I'm Amy Julia Becker, and this is Love is Stronger Than Fear, a podcast about pursuing hope and healing in the midst of personal pain and social division. Today, I get to talk with Dr. Haider Warraich. Dr. Warraich is a cardiologist, and he is also the author of The Song of Our Scars, the Untold Story of Pain. I am really grateful for his insights into how pain operates in our bodies and how acute and chronic pain are really different from one another, and how pain relates to our emotions and relationships and social situations and spirituality and all the rest. The inverse of healing in many ways is pain. So understanding the story of pain helps us consider how we can be a part of the story of healing. I hope you benefit from this conversation as much as I did. Dr. Haider Warraich, we are here today, and I am so excited to be with you. Welcome to this podcast.
Thank you, AJ, and I'm excited to speak to you as well about this.
Well, I want to start with an introduction. I'm sure there are listeners who don't know about your work, and I want to make sure that they do. So I'd love to hear just a little bit about who you are and also why you wrote this beautiful and compelling and fascinating book, The Song of Our Scars, the Untold Story of Pain. So can you just give us some background on you and why you wrote the book?
Sure. So, as my name is Haider, and I'm a physician and researcher based in Boston, and I'm primarily a cardiologist, but ended up writing this book on pain in part because pain is it's the most common reason why people seek the help of a physician or a nurse, is because a part of their body hurts. Sometimes it's in the chest, sometimes it's in the belly, sometimes it's the head. Most commonly, it's actually in the back. Back pain is actually the most common cause of chronic pain in the world. Um, so it's something that I deal with as a physician all the time, regardless of what your specialty is. But even more so, I guess, I wrote this book because pain has been part of my life. Even before I finished my medical school education, I suffered a pretty horrific back injury in medical school, which for a while threatened to completely derail my life and career. And though I got lucky and my pain got better, it's still a part of my life. Uh, but I feel like I had this inside view of not just treating pain as a physician, but also as someone who lived with it, without, any obvious deformity, without, at least on the outside, and wanted to see how can we put together a narrative or build a world in which we treat people in pain better, especially those who live with chronic pain.
Well, and that brings us to this topic of chronic pain really seamlessly. And when I first was introduced to your book, the reason I got it was because someone had forwarded me an interview you did for CNN.com. And in that, you wrote about the fact that acute pain and chronic pain operate really differently in the brain. And so I'd love for you just to explain that difference, because I think for so many of us, we might understand that acute pain and chronic pain feel different. We might have an experience of it feeling different, but we put them both under the same category. And at least I assumed that they operated the same way. And you're saying they almost operate in the opposite way. So could you explain
Sure.
that?
And I will say that this is not just uh, regular people, but even in medicine. I mean, if you look at, how we define chronic pain, is essentially the definition itself is, pain that occurs more often than not for 3 months or more. And so the assumption even built into the term is that, well, chronic pain is just acute pain that is felt over a longer period of time. And that's what I believed. That's what I think most of my colleagues believe as well. But when you look at the research, it paints a very different picture. And certainly, if you look at treatments, what we know is that so many of the treatments that work so well for acute pain, for pain that you might have after, say, you fracture your arm or you get some type of acute injury, actually don't work well at all for when you have a condition that causes you to be in pain for a long period of time or chronically. And what the science shows is that in many ways, let's say you have two people who get injured. Let's say when I got hurt lifting weights in the gym, there was a clone of mine, or someone very similar to mine who had the same injury,
Yeah.
and yet the chances that are that, one of us is going to develop chronic pain, but the other might not, and that the initial injury or the severity of the injury actually has very little to do with predicting whether me or my clone is going to go up to develop chronic pain. Um, and if you think about, well, other things, like maybe you say that, well, maybe there's something on an imaging test or an MRI that might predict, well, why did one person develop chronic pain and the other didn't? Well, it turns out that even findings on the MRI are actually not predictive at all of who is going to develop chronic pain. If, in fact, they don't even tell you if someone is experiencing pain in that moment, because so many abnormalities that we associate with chronic pain, especially chronic back pain, are found in regular people who have no pain at all. Uh, so, and so to understand why they're different, one of the things that's really fascinating, one of the sort of piece of research that's really interesting, is that over time, if you study folks who had an acute injury and then developed chronic pain, you see that begins to occupy different parts of the brain. So when you have an initial injury, the parts of the brain that seem to be more activated are those that relate to essentially just a sort of Google Maps of pain. Where is the pain happening? How
Hmm.
strong is it? The whys, wheres, and whens of pain. And then over time, the part of the brain that becomes much more activated with pain or in the chronic setting are actually the parts that are more related to emotions and fears and
Hmm.
other forms of trauma. Uh, and which just highlights that this idea that we have that pain is a purely physical sensation is actually not true at all. It's not supported by either the research but also by our lived experience as human beings. But that even over time, uh, pain becomes even more connected to how we feel emotionally, and our state of mind, and almost resembles any other form of trauma that one might experience that then we relive over the course of our life. I mean, that again shouldn't be misconstrued as just saying that, well, oh, because it pertains more to the emotional part of the brain, that somehow it is less important or it shouldn't be attended to.
Mm-hmm.
But it does certainly suggest that this idea that somehow acute and chronic pain are essentially the same phenomenon, the only difference is one is more chronic than the other, isn't is actually quite false, and is probably an important reason why we have actually done quite poorly at treating people with chronic pain.
Well, and I think, correct me if I'm wrong, the way you've described it is that acute pain goes from the body to the brain and chronic pain goes from the brain to the body. Is that an accurate way to talk
I think
about
in
it?
many instances that is accurate. Where I think that
Okay.
for usually what happens is that our we have all these nerve endings in our body, in our fingers, in our hands, in our feet, in our chest, that are always on the lookout for things that might be deemed as uncomfortable. Um, Once those signals are detected, the nerves fire and they send a signal up to the brain, and that's where the brain actually brings that feeling to life, which is pain.
Mm-hmm.
Uh, Pain doesn't hurt until it gets up to the brain and is transformed into that feeling. Uh,
Mm-hmm.
because again, pain is different from other conditions that we usually think about, because pain is actually a normal function of the human body. It's not a disease. Experiencing pain is actually very essential for our survival, and for our growth as human beings, um, partly because of one of pain's most important features is to teach us how to exist safely in the world around us. And yet, what we see with many chronic pain conditions is that they're no longer dependent on any signal coming from the body to generate that same experience. In fact, that experience is generated almost in an automatic fashion in the brain without needing any signal from below coming up to stimulate it. Um, Again, this is true for many conditions, and certainly it's not true for everyone. But that relationship between injury and pain, or how we hurt, changes based on whether you have an acute injury or whether you have a chronic pain condition.
Yeah, I think that's really helpful. And I'm curious about this relationship that you've already mentioned between the emotional and physical dimensions of pain, which in some ways, even stating it that way is misstating it. Because as you said, I mean, even that emotional center, right, is in the
Hmm.
brain. It exists in our bodies. So it's not some abstract or unreal part of us, and the way we talk about it as separate might even be part of the problem, but I don't really have other language for it. So I'd love to hear from you just the role that emotion, and even you also talk about pain as
Mm.
memory, which I thought was so interesting. Like, in what way what's the role of emotion and memory when we're talking about
Yeah.
chronic pain?
Um, so you're absolutely right that we how we kind of frame and portray the mind and the body. Just by saying that, we're actually part of the problem, because in reality, there is no real difference there's no line where, the mind starts or the body begins. Everything is kind of generated in our brains. Our sense of who we are as human beings, both as physical beings, but also as metaphysical beings, is all created in the brain. How we know where our fingers end, or our toes end, or where the top of our head is all
Mm-hmm.
based on how our brain creates this projection of who we are in physical space. And same is true with how we feel. And you to see this idea that what we feel, or is and how that affects us in a real way is, perhaps, is seen in every aspect of medicine, or in every aspect of health and disease. One condition that we see very often is PTSD. So, PTSD
Mm-hmm.
occurs not because or is not necessarily because someone had a physical injury, but whatever trauma that person experienced is actually having a very real and very often crippling effect on that human being, both mind and body, sometimes years, if not
Yeah.
decades after whatever caused them to experience that trauma to begin with. And so we have countless examples of um, where this idea that the mind and body are separated are completely false, and they kind of fall apart. But yet, when it comes to pain, I think in part because we've been trained to think that, oh, pain is, or and especially recently, that pain is just a very simple mechanical disturbance in our body, and that
Right.
that what we feel is essentially a response to that, um, is doing injustice to the complexity of pain, but also limiting the things that we can do to actually help the person in pain. When it comes to how emotions are connected to pain, we go back to that example of, why does one person develop chronic pain and the other one doesn't? Two people get injured on the same
Yeah.
day, and one person does and the other doesn't. I've already mentioned the things we know do not are not associated with that transformation. We know that the extent of the initial injury is not associated with the development of chronic pain. We know that abnormalities or imaging abnormalities are not related to that. And the question is what? Well, one of the most important risk factors for the development of chronic pain is the experience of having had an adverse childhood experience, for example. So if you're someone who
Mm-hmm.
has grown up in a troubled household, or if you've grown up in a neighborhood where you were always scared and you saw things that maybe you shouldn't have seen as a child, or maybe you were bullied, or maybe you were abused in in any form, that changes our brain in a way that it makes us much more likely for that transformation from acute pain to occur into chronic pain. In part,
Mm-hmm.
and again, I think we're still trying to figure this out. But and the more trauma that you've experienced as a child, for example, the more likely you are to develop chronic pain. We know that conditions such as anxiety, depression, and others are also not just products of pain, that you can develop depression and anxiety after you've had a chronic pain injury, but also that they are some of the most strongest risk factors to determining if someone is going to develop chronic pain or not. Uh, the way I think about this is, again, it just confirms, I think, that what we already know as human beings. We all know that the state of our mind affects how our body feels, and how our body feels affects the state of our mind. There's just no,
Mm-hmm.
I think uh, because for so long our tools in medicine and our approach in medicine was so simplistic, I think just for practicality's sake, we created these distinctions, because again, we just didn't know, we just never understood the mind. We didn't have tools to make that could work there. We were much better at putting broken bones together than healing
Mm-hmm.
trauma or understanding depression or understanding anxiety. That we created these distinctions, but now I think that those very distinctions and that way of thinking is coming back um, to haunt us and affect the way that we can actually help people. With regards to memory, I mentioned a bit about PTSD, but actually PTSD has a lot of similarities with chronic pain as well. And in fact, some of what some scientists are doing is actually thinking about, could we actually use or retrofit therapies that we know work for PTSD and see if they will work for chronic pain. And the reason people are thinking about this is that, at least in animal models, because again, it's very hard to study pain in human beings. You won't want to sort of hurt a human being, and even
Mm-hmm.
in animals, I think people are do it responsibly, but that's the closest we can get to understanding the experience. But if you look at for example, mice that have chronic pain, what you see is that the same molecules that are responsible for forming memories in the hippocampus, which is where our memories live, also start to appear in or become activated in the areas that are responsible for chronic pain. And in those experiments, when they've given sort of substances that prevent the formation of new memories, you actually see that the development of chronic pain after an injury is also much lower, suggesting that and we've seen there have been some examples in real life where people who've had chronic pain have had um, episodes of amnesia where they've lost their memory, but not only did they lose their memories, but they also forgot, or they actually overcame their chronic pain as well. So I think there's a
Mm-hmm.
lot more that we are understanding about chronic pain, because because um, I think people realize what a significant problem this is in our society. Chronic pain affects, 1 in 5 people, both in countries like the US, but also around the world. Uh, we've we've realized that our existing treatments for chronic pain are actually quite bad. I mean, we've seen that with the opioid epidemic, which initially started with people getting opioids for pain relief, but then led to this whole um, sort of crisis of addiction that's really overrun
Right.
this country. Um, but also that they were just not that effective either. So I think that I think we're actually at a fairly exciting place with regards to changing how we think about chronic pain, thinking about how we can apply new approaches to help people in chronic pain, um, and also just talking about it more rather than just let it fester.
Well, and I want to ask you, I want to get back to some questions about both the medicalization of pain and the opioid epidemic in a minute. But before we get there, just to talk about this emotional connection for one more minute, you wrote that you often see patients, this is a quote, who take offense at the notion that their pain is as much physical as a psychological disorder. And I've often wondered whether there is essentially a sense of shame in our culture around chronic pain if it is a matter of memory or emotion, as opposed to no, I had this injury and that's the only problem here. It also seems to me that in terms of the treatment of pain, if chronic pain does have to do with emotions and psychology and not simply bodily harm, I mean, again, not having quite the right terms for all of this, and we deny that emotional component, then it seems it's going to be a lot harder to treat. And I wondered if, from your own experience, like, was there a way in which you were able to address the emotional or psychological components of your chronic pain that gives you some perspective on what's going on with patients in that same
Yep.
position?
I mean, I think we've seen this with mental health disorders that we just don't, that in our society, not just here but really around the world, that we just don't take them as seriously as we would, say, a condition
Mm-hmm.
that we can get a blood test for, or that we can see on an X-ray or a CT scan. And that same thinking seeps into other conditions. And patients and people are smart, that they know that if they go to a physician, or they go to seek health care, and are focused on finding an abnormality that can be sort of visualized in a sort of very real way, and if that is found, then they know that they're going to be taken more seriously, that their suffering is going to have a cause that can be understood and provided legitimacy in our health system, which is not the case when if you have a condition that is either primarily or driven by a mental health condition, or is made worse by it. So
Mm-hmm.
we know that many that patients are not going to come and want to change the paradigm here, because we know that any such attempt will mean that whatever little attention or care that they receive from the health system might get denied to them, because we're so much more attentive to conditions that we think are because of anatomic abnormalities.
Right.
So I think that and I think the downside of something like this is that what it's doing is that it's limiting the sort of things that we could provide for patients beyond just sort of pills and procedures that could actually help them not just live better with the pain, but also potentially overcome it in many circumstances. So but at the same time, I'm also hopeful, because we have seen, for example, a lot of progress in a better understanding and realization of the importance of mental health in this country and others as well. So we have had progress there. It's not like we are still living in a
Yeah.
same paradigm in which we don't think that these things matter. I think that people do realize that psychological disease, or disease that's made worse by psychological factors, is as serious as anything else that we experience. And my hope is that we will carry that through and into conditions such as chronic pain. Um, Again, so that people have a more real understanding of the condition, but also have access to therapies that could help them in those circumstances.
Mm. Well, and it speaks a little bit to something you also write about, which is that I think if medicine reduces the human to anatomical abnormalities, then we are going to, especially when it comes to the problem of treating chronic pain, we're going to reduce the possibilities of what it might mean to treat that pain. And whereas if we can expand our understanding of the human, you do a great job, I think, of even writing about the ways in which, like, the Industrial Revolution we started comparing human bodies to machines. And so if something breaks, you figure out what the component part, you replace it, and then you keep going. And human bodies aren't machines. They just are not. That comparison breaks down. And the medicalization of pain and of the human body have all contributed to that. And I think that moves pretty seamlessly into the way in which you're talking about the opioid epidemic. And I thought your chapters on that were really riveting. I mean, I felt like I was reading like a page turning novel just to find out all of these details about the epidemic and the industry, which I've, seen, but not. It's like I've read articles over the course of the past 20 years as opposed to seeing it all in one place, which you've done in your book. So I'm wondering if you could just explain how a modern understanding of the body and of medicine contributed to what we saw happen in this couple decades of overprescription of opioids, and then this epidemic that really harmed so many people.
So, I mean, if you look at the history of how we've understood pain, when pain was almost, or very frequently seen to have a purpose. If you felt pain, especially chronic pain, that there was a reason that you felt pain. Maybe it was because you felt that you had um, not been a good person, or that you hadn't that this was some type of test from from God or another, or celestial agents,
Mm-hmm.
and that overcoming that pain or living that pain actually was not a meaningless thing, but it had some it had that it was not just an event, but it was a journey that you were on.
Mm.
And Oftentimes when we sought help for pain, it wasn't just that we went to physicians, we went to a priest or pastor asking for spiritual
Yeah.
help and spiritual healing as well. Because I think we understood that there's more to pain than just a body breaking down, but really that there is a greater dimension to it. Um, and then what happened was that as we kind of moved towards a more biomechanical view of the body, one of the things that was done was to essentially create this dichotomy between mind and body. And part of it was that we were just better at understanding the body than we were at understanding the mind. So some of this was just that just seemed like the practical solution to a problem. So then we, divided medicine into doctors who treated the body, which is all doctors, and then psychiatrists who treated the mind, or
Mm-hmm.
psychologists. Um,
Mm.
and we saw a lot of progress in overcoming ailments of the body. But we didn't see the same type of progress with regards to how good we are understanding mental health and mental disease. Um, what happened at this point was that we had developed these drugs, or well, we hadn't really developed them. We had these opioid products, which are essentially products from the poppy plant, have been present for thousands of years, and every so
Yeah.
often our societies, both here and around the world, have gotten into this really sort of this fatal attraction with this plant, where that many societies have had to deal with crises of addiction to opioids for thousands of years, because again, these
Yeah.
are compounds that are some of the strongest, most potent chemicals in existence, and they have some qualities that are hard to replicate. But more recently, we had this crisis of people living in chronic pain, especially people having a lot of pain at the end of life, oftentimes when they had some type of, cancer diagnosis or other condition that was caused a lot of discomfort. And a movement was started to to destigmatize the use of opioid medications for people who had a lot of pain. And this was a movement that
Yeah.
was meant to overcome a lot of suffering and needless suffering that people are having. But then what happened was that this movement was hijacked by forces that felt that, well, how about we just expand this to everyone, not just people who have some type of serious
Mm-hmm.
illness or who are people who are at the end of life, but really to anyone who's living with has a headache, who has a bellyache, who has back pain or
Yeah.
joint pain. Um, Despite there being no evidence of the safety or the effectiveness of these medications in these chronic pain settings, but because I think that the time was such that we were really sort of wanting to eliminate pain, and that this promise felt real that we could live in a pain-free world just as long as we just gave enough people these medications. Um, that and because we had come to accept the fact that, well, pain was just like was a completely physical thing, and it was like your heart rate or
Mm-hmm.
your blood pressure, that you could just essentially treat it as long as you just gave enough medication. um, and ignored the fact that there's more to pain than just that there it has these vast dimensions of that are connected to our emotions, to our histories as human beings, to our histories of having lived with trauma, etc. And that had all these spiritual dimensions that we've known and have attended to, but then left all of that aside and focused on it as if we would essentially an abscess or anything else that can be that is very much a physical condition. And what that led to is essentially the opioid epidemic, where out of good intentions, um,
Mm.
to help certain people or a small segment of our population that truly needs to be pain free because they have a terminal illness or have a serious illness, we allowed this to spread essentially throughout our entire society to all people who had any sort of, even after people after getting a dental procedure, for example, even if they came and they stubbed a toenail in the emergency room, they were being given opioid prescriptions, oftentimes for weeks or months, that
Yeah.
addicted them to these drugs. So now, especially as we think about, and in fact, that crisis has really gone on unabated. Almost 100,000 people died of overdoses last year from opioids. Um,
Mm.
I think now that we think about the future and think about, well, how can we best help people, especially those with chronic pain, who now are stuck in this weird place where they have an illness that causes them discomfort, but also they've essentially been made pariahs in a system that treats them now as addicts, despite the system being the agent of giving them those drugs to begin with.
Right.
Um,
Right.
I think, but to get there, we really have to really have a cleared eye view of what, especially what chronic pain is, what it means, and the fact that it isn't just a physical sensation, but really one that spans phenomena such as emotions, and memory and trauma, as much as the physical realm.
Well, and I want to get back to what you just were talking about in terms of how we actually address chronic pain from a more holistic dimension. But before we do that, I wanted to add in just the factors of race and
Hmm.
gender because you write about these things. And I think actually bringing those in not only just names the fact that there are disparities in who experiences pain and how they experience it, but it also brings up the fact that there's a social phenomenon, right, going on. There's a story to our pain. I mean, even the title of your book, The Song of Our Scars, The Untold Story of Pain, like there's just an emphasis there that this is not something that simply can be kind of analytically
Hmm.
measured on a data set. And I think the fact that race and gender, and I'm sure other social factors really do contribute to our experience of pain, speaks to the fact that this is more than anatomical. But could you just give a little bit of context for the ways in which race and gender factor into pain?
Sure. Uh, Despite our best efforts and our hopes, but I think, going again, speaking to the nature of pain, there's really no blood test for pain. As a physician, when I see someone, the only way, unless they have something that is clear and obvious, let's say that they have a condition like appendicitis, which I can see on a CT
Mm-hmm.
scan and looks like they're intestine, that part of that intestine may explode, they need surgery, it's going to cause them acute pain. Unless you have something like that, or they're having a heart attack that I can see with blood tests and EKGs and whatnot. Even with that, when I ask them about their pain, I'm only relying on what they say. I have to
Yeah.
choose to believe what they have to say, and I have to then determine whether that is going to be something that I'm going to go with or not. Uh, and so in some ways, because it is so subjective, it taps into some of our deepest prejudices. So any type of prejudice or any type of that we carry as members of this society, uh, whether that's sexism or racism, that is going to seep into especially how we consider the person in pain, whether we choose to believe them or not, whether they look the part of someone that we've been trained to think about as the right person in pain. Um,
Mm-hmm.
so any vulnerability that you have in society will be exaggerated when you are in pain. If you're a woman, if you're a black person, if you're poor, if you're disabled in any way, if you don't speak English, if you're not affluent, I mean, all
Mm.
those factors are going to become exaggerated when you seek help for pain. But even let's take a step forward. I mean, I mentioned, for many people with chronic pain, oftentimes there's no blood test or imaging test. But let's say that we look at conditions in which it is well accepted that the patient that and it can be easily diagnosed as someone is in pain. Let's just go back to the example of appendicitis. So, acute appendicitis is one
Sure.
of the most common causes of or reasons for people getting surgeries in this country. Your appendix, which is kind of part of your intestine, can become suddenly inflamed and could burst if it's not removed with surgery, and it is one of the most painful things that human being can experience. And yet, even in people who have appendicitis, not just people, even in children who have appendicitis, that is confirmed on a CT scan, there still is a wide disparity in who does and does not get their pain attended to. So there's this one study that I often talk about and cite of a million kids who presented to emergency rooms around this country with acute appendicitis that was confirmed on a CT scan. In those, even in these, and again, these are children, so you would think that, well, we would be more trusting of children than we might be of adults. Maybe you think that, adults are just seeking
Yeah.
drugs. You see that black children only have about 20% of the odds of receiving an opioid painkiller than white children, even at the same severity
Huh.
of pain. So all these everything that as physicians, as members of the health system, we are still part of this society. We still carry many of the prejudices that are despite the fact that I think no one wants to think that they think this way. I mean, and no one likes to think that
Right.
their colleagues are affected by these, but we're all part of the society, and especially for the person in pain, who is at such a huge disadvantage because again, they may not have a blood test to back up their claim of how much they're suffering. It affects people even more so. Many of these biases that we have with regards to how pain is treated have these sort of long historical records that shape to this day how we treat people. When we think about Black Americans, for example, I mean, there's this very prevalent thought, not just in the public but also amongst physicians, that Black people have thicker skin than white people, and that causes them to
Right.
have a higher tolerance of pain. Um, and in our society oftentimes we may feel that, a higher tolerance for pain is a good thing. Many people think, for example, that women
Mm.
have a higher tolerance of pain because they have to have menstrual cramps every month, they have to undergo childbirth,
Yeah.
but yet that same notion actually then might prevent them from treating pain effectively, um, because they might feel incorrectly that if you're a black person, that your threshold for pain is higher, so somehow you need less painkiller, or if you're a woman, your
Right.
threshold for pain is higher, somehow you might need more you might need less attention for your pain. So I think especially in pain, I think these biases and prejudices play a really important factor. And I think it is just important to make sure that we are, and again, it goes into this idea that pain is not just a physical sensation. It is part of our society. Pain is political, pain is gendered, pain is racial, and all these, and to isolate it from all these greater forces is actually doing it a disservice, because we don't realize just how broad and far-reaching this phenomenon is.
Well, it makes me wonder whether there is a, I think you're right about this, but just that if our pain is not believed by someone else, right? If we can't, is that part of making meaning of our pain? Is like there's something that happens in being able to share the story of our pain, even if someone cannot give us a drug to medicate it. That sense of even, I mean, literally a listening ear, a hand on your arm, a warm embrace, whatever. I mean, there's something about being believed in the midst of our pain that actually can alleviate at least some of it. I mean, am I right about that? Is there's something that we need in terms of being believed?
Absolutely. I mean, if you think about one of the things that, we talk about all the things that don't work or don't help the person in pain, but what does help the person in pain is in the expression of empathy, not just
Mm,
from their physicians, but also from their loved ones. I think you asked earlier that, what is, what in my life was, sort of speaks to some of these sort of greater dimensions of pain.
yeah.
Uh, Part of, now that I look back, I mean, when I got hurt, um, after my injury, it wasn't just that I was in pain all the time, but I lost all my friends. No one would, show up. All my social activities, things that I love doing, like playing sports or going out with my friends, that
Mm-hmm.
went away as well. Um, and and so my part of what sort of was surely a factor in the transformation of my suffering was, in fact, that loss of sense of self and my own sort of sense of who I was, and being denied essentially the very things that would allow me to recover. And it wasn't until those things started to come back and I started to um, find a network of people who were able to sort of love me and be there for me, despite the fact that I wasn't the most fun person to hang around anymore.
Yeah.
Allowed me to sort of get better. Also, the physical therapists who work with me, it wasn't just it wasn't just the exercises that they taught me, but it was the fact that they cared for me, and that they showed that through their actions and their words.
Yeah.
And we have plenty of great research to suggest that that's true, not just for me but for others as well. So I think empathy is extremely important, and we know that patients of more empathetic physicians tend to have better outcomes with pain. We know that if you teach just a physical therapist to be more empathetic, and to be more present, that their patients are going to actually do better and actually require less physical therapy to get better. So everything is
Hmm.
connected, but I think love and support and emotional connection are both a huge part of recovery, and the lack of those things are a huge reason why so many people are in pain, or their pain gets worse, is because they lack those things, or that those things were taken away from them, sometimes because of the pain or sometimes
Hmm.
preceding the pain, that then uh, leads to uh, them really being being trapped in the grips of this condition.
Yeah, I resonate with that so much. I didn't have a pain condition when I was in high school, but I did have a paralyzed
Mm.
stomach. I had
Mm-hmm.
gastroparesis, and so it was actually not painful at all because I couldn't feel anything. And yet, the way in which I finally, after many years, and there certainly was a psychological dimension to what was going on, but the way in which I really found healing was through physical therapy. And I just resonate with what you were saying because it was this physical therapist who was both massaging my internal organs and talking to me with great empathy and interest in my life. And it was that mind, body, spirit, emotion, relationship connection that really woke my, organs back up when I look back on it. And similarly for me, I mean, the other thing I think about, I had an experience of pretty minimal chronic pain in the sense that I was not, going to the doctor and taking opioids, but I was waking up in the middle of the night for at least a year, maybe longer, and taking a Tylenol PM or Advil every single night because my back hurt.
Mm-hmm.
But there was no precipitating incident. I mean, it was just essentially I was holding tension in my back, but I didn't think about it that way. I thought about it as just like, what's wrong with my back? And it was not again until I began to actually look at some of the what's going on in my life. We had moved recently, so I was separated from a network of supportive people, was asking questions about identity. There were some literal stresses just in the sense of having small children and running around after them in a new place and trying to, figure those things out. But the bigger issues, I think, had to do with the emotions. But I had no narrative. The only way I could make sense of the fact that my back was hurting was by taking a pill, and eventually I was like, I can't do this for the rest of my life. What's going on? And so that's when I started to explore some of these other things. And I guess it leads me to a question of just, I wonder, as we think and we come to the end of this conversation, not just about pain, but about healing, how do we actually make those connections? How do we move from places of chronic pain to healing or even just alleviation of that pain on some level? Do you have suggestions or recommendations for people who are in the midst of chronic pain or even just chronic discomfort, which maybe is what I would say I was
Sure.
experiencing?
Um, I think one of the things that how I've changed my practice is when people have chronic pain, I often will I'll explain, much of what I've shared here about, both sort
Mm-hmm.
of myself and also sort of my sort of view of chronic pain as well, but also how that's backed up by the science. But I'll try and reframe people into thinking about pain as like any chronic disease, like to think about diabetes, for example. Where
Mm-hmm.
taking care of diabetes involves changing your life, and then but also then living with it, and finding a good way to live with it despite having diabetes. And so part of I think an approach towards living with chronic pain is in a way of not allowing it to dictate your life, but which might mean doing things even if it hurts. I mean, going to see your friends or attending a birthday party, even if you're in pain, because one of
Hmm.
the main instincts of when you hurt is you want to not do anything at all because you're worried that that's going to make the
Yeah.
pain worse. But if anything, when we cave to that desire or that urge, we actually narrow our lives even further. We actually allow pain to erect an even more uh, powerful cage and prison around us. And in our attempts to control the pain, we actually allow it to control us back even more. So
Mm.
that's I think, and this way of thinking is called acceptance and commitment therapy, and it can be you can receive it
Hmm.
formally from a psychologist, but essentially the point is
Hmm.
to to emphasize quality of life and living despite being in pain, rather than trying to control the pain at all
Yeah.
costs. Um, I think if you're living in pain, I think seeing a pain psychologist, I think, is something that I recommend to a lot of my patients. And the reason is, again,
Hmm.
they can allow you better ways or coping mechanisms to live with pain. I think surrounding yourself with people who are empathetic is important. I think if you're in a toxic relationship, it's not just going to affect how you feel in your minds or in your hearts, it's also going to affect how your body feels. Um,
Yeah.
so and then those are some and then you mentioned this already, but I'm a big believer in the role of exercise as well. For me, that was really one of the main things that helped me to get better. And the reason sometimes people can be reluctant to exercise is because after you hurt yourself, exercising really hurts. When you go and
Yeah.
you stretch, and if you have a sore back, chances are initially you might actually feel more pain. But what we know
Yeah.
is that exercise, especially for people with chronic pain, can be extremely helpful and useful in helping in essentially providing an additional path uh, to to recovering. Um, and then the last thing I will say, and this is also the area of really interesting and important research, is that one of the worst things about pain is the fear that it generates. And for oftentimes, when you hurt
Mm.
when I hurt in my back and it was bad, um, I've worried that, am I going to be able to walk again? Or if I did something and that hurt, I
Yeah.
would immediately stop because I was worried, am I going to make things worse? But once you have chronic pain, or once you've had, that fear is essentially doing you no good. And there are new forms of sort of cognitive therapy. There's one called pain reprocessing therapy, and all it does really is to separate that fear that people have of pain. And what the trials of that type of therapy have shown is that people who receive that therapy are much 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 more likely to be pain free and to have their pain go away than those people who get sort of our usual care for chronic pain. And this was studied in back pain, but is being studied for other reasons, other indications as well. So um, what I think what is clear is that there's no silver bullet for pain. If someone's selling you
Mm-hmm.
a magic potion or a way out, chances are that they're not being completely honest. But I think that but it takes a lot. But I think that if you surround yourself with good people, if you have a mindset that in which you are not going to sacrifice your life in the service of being pain free, if you seek out physicians who are empathetic, and if you keep an open mind about new forms of therapy, whether that's mental health therapies or non-opioid forms of therapy, I think that there is hope for recovery for most people.
Yeah, I love that, and it makes a lot of sense of what you've said. I do wonder, is just kind of a final question on the spiritual dimension of things, which obviously is not something that any doctor is going to prescribe, but at the same time, a lot of what you're talking about, I think, does speak to the human
Hmm.
spirit, and I'm thinking about practices of prayer or meditation, or I mean, even the prayer practice of literally like
Hmm.
laying on of hands, which can certainly be used as kind of a sham huckster thing, but also it seems like even that experience of physical touch and
Hmm.
empathy that's expressed through that, and not to mention whatever might be happening on a spiritual level with prayer. But I'm curious just to hear whether you think there, for people who are open to it, is spirituality another dimension of potential care when you're in pain?
100%. I mean, the way I ask the patients is that, an open-ended way to ask this is if, faith or spirituality hold importance in someone's life. And if the answer is yes, then I think that opens up a whole different avenue for helping to,
Mm-hmm.
again, find meaning, find resonance, find for why we are here, why we exist, why we feel the way we feel,
Yeah.
and then potentially using that as a way to chart a course towards healing. Like I said, it takes a lot. I mean, but it takes a lot of, sometimes just good luck, but also just having an environment in which you can look beyond the pain. You can get out of your body. One of the things that pain does is that it directs all your energies inwards. So you're only thinking
Mm.
about what's going on in your body right now because pain just grabs your attention and just holds it in a way that
Yeah.
few other things do. And again, there's a reason for that. The reason is that pain is meant to be protective. If you step on a
Mm-hmm.
rusty nail, pain wants you to immediately dislodge it from your foot before it gets
Yeah.
infected. But after a certain time, that power, that force becomes a negative force, and it serves no purpose other than to just multiply or perpetuate suffering. So anything that can help us get out of our bodies and live our lives and be open to joy and happiness and experiences in other people, I think is going to be essential to allow people to get better.
I love that. Well, thank you so much for being here with us today and just for your great work. I'm going to mention the name of your book again for listeners, The Song of Our Scars, The Untold Story of Pain. It's a beautiful book and was really thought-provoking and helpful to me. So thank you for writing it and thank you for being with us.
Thank you, AJ. It was a pleasure talking to you.
Thanks, as always, for listening to this episode of Love is Stronger Than Fear. Thanks to Jake Hansen for editing the podcast, to Amber Beery, my social media coordinator. And finally, as you go into your day today, I hope you will carry with you the peace that comes from believing that love is stronger than fear.